everything inside our bodies are just as different as things outside our bodies. Everyone's face is different. Everyone's smile is different. So too, everyone's heart is different. So why is it important to print a heart? The first is, again, about empowerment of the patient and allowing the patient ownership of their own disease and their own care. If they can possess their own organ and see this is what it was like before surgery, this is what it was like after surgery, it makes the whole process more sacred than profane. It's just wonderful to see the reaction of a patient when they receive a beautiful object that is representative of their own health. For the clinician, we can plan surgeries and plan procedures. So, for example, we have a procedure in the field of structural heart disease where we exclude from the circulation a portion of the heart where clot forms. So with a 3D print, a proceduralist can do the whole procedure in simulation prior to doing the actual procedure. And this is a very important thing, not just for the practicing faculty physician, but also for trainees. So 3D printing, in addition to being important for art students and for folks like me, is important for simulation and training. Many years ago, I'm getting a little bit older now, when I was doing my internship at a little hospital outside of Chicago, every patient who had a heart surgery or valve surgery went home with a pillow shaped like a heart. And ostensibly this was because they could hold the pillow when they coughed, so that their sternotomy, incision, and site would not hurt them. The real power of that is that the patients went home with something. And it was just amazing how different it was at this little hospital than the university hospital at which I had trained. So that stayed in my mind. It's been in my mind for years and years. That was a generic heart-shaped object. I would love to send every patient home with their own heart. To me, that would take what I saw as a trainee and make it something much bigger.